in 2019. They say vape terkawal. So let us rethink whether vape is terkawal or not at the moment. Okay, so can vaping cause cancer? Now, vaping can cause DNA damage. When the DNA is damaged, it gets confused, then of course, it can cause cancer. DNA damage can cause oral cancer, okay? It can lead to leukemia actually, lung cancer also. So these are the things that you can counsel your patients. Yeah. What about mental health? This is very, very important. For the past few years, mental health illness or e-cigarette users, whether it's they start off by using e-cigarette developing mental health effects, or it's the other way around. There are many studies about it. Okay, but what can cause mental health effect is the nicotine, because nicotine is a substance abuse, okay, causing addiction. What other substances leading to addiction that is available in e-cigarette? As you know, in e-cigarette there can be illicit drugs being put in the e-liquid. Okay, so what are among the illicit drugs that can be added into the e-liquid? So the latest one is the zombie vapes. If you have been reading newspaper or the shorts in Instagram ke, in TikTok, you see that in Singapore there are people in Singapore that just jatuh saja dekat tepi jalan raya. So they suspect that it's from zombie vapes. So what are the content of zombie vapes? Zombie vape ni nama lain dia piau-piau ataupun K-pop ya. So content dia adalah itomidate. Okay, so itomidate, it actually imitates high level of ketamine, which can cause a rapid onset of sedation, okay, imbalance in movement, which is ataxia. It can cause dizziness, hypotension, which is low blood pressure, irregular heartbeat, which is arrhythmia. It can cause aggression, psychosis, and also loss of consciousness. What are other illicit drugs that is available, that has been found in e-liquid, such as THC, cannabis, cannabinoid, methamphetamine, fentanyl, cocaine, and ketamine. And also ketum, ya, ketum pun pernah dijumpai ya, in e-cigarette liquid. Okay, so these are some of the newspaper cuttings for the past few years. Toddlers suspected to have suffered nicotine poisoning due to vape. This was a few years ago, okay? Even during COVID time, there was a small child who developed seizure from e-liquid intoxication. Okay, 3 13-year-old girls gang raped in Sabah, Kota Kinabalu, Sabah. Dizzy from vaping. This was from last year in Kanga, even in Penang pun ada. This was last year or 3 years ago. So how is it affecting our public health other than the things that I have explained to you just now? So we know what can happen to human, what can happen to environment, animals, and economy. So these are all very important. But before that, we have to understand the concept of second and third hand smoker. So second hand smoker ni apa? Is it the same as third hand smoker? Many of you would already know. So maybe this will benefit some of you yang belum tahu ya. So second hand smoker is the smoke that is being exhaled by the smoker plus the smoke from the tip of the burning cigarette, vape ke, pipe ke, hookah ke. Okay, so when we are directly exposed to this person, we inhale it, then it's called second hand smoker. In a third hand smoker is the residue of the e-cigarette or the cigarette that lingers and settles on the surfaces. Contohnya lah, you masuk dekat bilik hotel kan, in that hotel room, walaupun 3 months ago the person that he smoked in that room, what can happen is that the residues from the cigarette can deposit onto the upholstery, the carpets, the curtains in that hotel room. So as you enter that hotel room kan, you will be inhaling the air that has been interacting with the cigarette punya chemicals. So this is more dangerous for babies who crawl on carpets, This is because they can get absorbed through the skin. Yeah? So sama je lah effect dia. Okay? This is from our book called Generational Endgame Advocacy book that is in the process of publication. So effects to pregnant women, what can happen to actually the baby, low birth weight, miscarriage, stillbirth, abruption of the placenta, early childhood exposure, apa jadi? 6. Attention deficit, hyperactivity disorder, poor academic performance, and they can become smoker when they become bigger. Okay, effects to children, they can have worsening of asthma, recurrent lung infection, and chronic cough. There are many studies to prove that children get middle ear infection, which is otitis media, also poor development, okay, in growth. Okay, let's watch this video.
Are you familiar with the dangers of secondhand smoke? Secondhand smoke is the common name for more than 4,000 different chemicals that are released into the air as tobacco is smoked. Many of these chemicals have been shown to cause cancer. In fact, a cigarette left burning in an ashtray puts off more poisons than a cigarette that is being puffed on. That's because when a person smokes a cigarette, their lungs act as a filter before they exhale the smoke. Secondhand smoke isn't just the cigarette smoke in the air. It can be absorbed into furniture, walls, clothes, children's toys, and even skin. Tiny, dangerous particles from the smoke can remain active for several months after a cigarette is smoked. Children who are around secondhand smoke get sick more frequently than those who are in smoke-free environments. Children who live in a house with cigarette smoke are more likely to die from crib death before they reach 2 years of age, have severe episodes of asthma and pneumonia, have frequent ear infections that can cause them to lose their hearing, have trouble in school with learning and behaving. Children get sicker from cigarette smoke than adults do because they breathe faster, breathe more air, and have smaller airways than adults. Though you may think that turning on a fan when you smoke helps clear the air, it actually can make the problems worse. Fans, air conditioning, and heating systems spread cigarette smoke throughout the entire house or room. Even going outside to smoke does not protect children from secondhand smoke. Secondhand smoke clings to clothing, hair, and skin. When you go back inside, the poisons come with you. Smoking in a car creates even more danger for the child. The level of poisons from secondhand smoke is highest in closed areas, so smoking in a car with closed windows creates greater problems for children than anyone else in the car. To help reduce your child's exposure to secondhand smoke, smoke outside, then shower, shampoo, and put on fresh clothes before holding or feeding your child. These are only small steps. The only way to completely protect your child is to not smoke. Make your home a smoke-free world for your child. Don't let anyone, friends, family, or visitors, smoke in your home. Most importantly, ask your doctor for help in quitting smoking. Your lungs, your child, your family, and your friends will thank you.
Ulang ya. Sorry, I have to unshare and share again ya. Ulang. Okay, let's talk a bit about the effects of smoking on the pets. and also other animals. So animals can get second and third hand smoking effects, not just human. And because pets actually stay closer to the ground, and also they groom themselves. So they spend more time indoor. So their exposure is actually higher, and the smoke actually settles on the surfaces and also on the pet's fur. So they can get infection and diseases. What are the diseases that they can get? They can get lung cancer, oral cancer, nasal cancer, especially for long-nosed dogs and cats, chronic respiratory disease and irritation, bronchitis, eye infection. So for cats, they are highly prone to feline lymphoma, fatal immune cancer. And they also can get SCC from ingesting toxins while grooming. So for dogs, they are at higher risk of lung and nasal cancer. Okay, so they are more prone to nasal tumor. They also have high risk to develop bladder cancer and allergies. So what are common symptoms of nicotine poisoning in animals? So these are the things to watch out if they have pets, and you can ask whether they have pets, if they are smokers or e-cigarette users. They may have drooling, vomiting or diarrhea, restlessness, agitation, elevated heart rate, tremor, muscle twitching, weakness, they may collapse, they may have seizure. Okay, in severe cases, they may have loss of consciousness. Alright, so I'm quoting from Code Blue, published on the 2nd of May on economic impact to Malaysia. So for cost for treating tobacco-related disease is 4 times the tax revenue gained from the tobacco products. And now kita tahu there's a cut of budget kan kepada Ministry of Health. So sudah tu mengukuh kan. Okay, national productivity loss, they can present with not present because they don't come to work kan. They often take MC, they can have premature death. Okay, there's 27 deaths annually from cigarette-related use. Okay, so what it impacts? It impacts the education, healthcare, and also social development, and also major environmental pollution, deforestation, open burning. So kita tahu banyak the burning ataupun kebakaran yang berlaku is because of the cigarette. Even from e-cigarette, because of the combustion from e-cigarette, it explodes. It can actually burn the body. Okay, it has also burned the beddings also. Alright. So policy recommendation. Okay, to keep public informed. This is the recommendation that we're making, and hopefully that you agree with this recommendation also lah. To keep the public informed, okay, and updated regarding the risk of all tobacco and imaging products, to protect public from all the dangers of second and third hand smoking, all the e-cigarettes and imaging products, and to ban the sales of tobacco and imaging products. To strongly advocate for GEG, okay, UK is doing that now, GEG, okay, hari tu kita ke depan, sekarang kita ke belakang, dia orang pula ke depan. To ensure tobacco control policy is properly and strongly enforced, we want to prevent the new smokers or uptake of vapors in Malaysia. We want to assist smokers and vapors to quit, and also we need to denormalize smoking and vaping all over Malaysia. Alright? So with that, I thank you.